1 in 8 women will develop breast cancer in their lifetime. Treatment often involves surgery. Plastic surgeon Dr. Michalke offers breast reconstruction.
I'm usually there the same day as the surgery. So the mastectomy is performed, and then I come and start the reconstruction. The reason why that's so important is because we can save a lot more breast skin. We have a more aesthetic reconstruction.
Surgical technology and implants have improved over time.
20 years ago, the goal was to make something that looked like a breast mound on the chest. Now our goal is to try to make something that looks like a breast all the time.
Dr. Michalke is also trained in microsurgery.
I perform kind of like small transplants of body tissue from one part to another. So I can build a breast out of the patient's own soft tissue and maybe not even have to use implants.
The full reconstructive process and recovery can take up to a year, but the prognosis is positive.
The mastectomy is very much an amputation of a body part, similar to if a leg or finger or something was cut off or removed. And so helping to restore that to a woman can help with a lot of restoration of confidence. Often patients say that we change their life because they feel like they can get out more, do things without feeling self-conscious.
For Lee Health, I'm Devin Turk.